Hey everybody, we're going to be talking about the mechanism of the S3 heart sound today. The S3 heart sound, also known as ventricular gallop, is best heard using the bell of your stethoscope located over the apex of the heart. This is due to the low frequency sound of the S3. You can usually hear this immediately after the S2 and make sure that it is actually a distinct sound instead of a splitting of that S2 sound. It typically sounds like Kentucky, Kentucky. You can also hear a diminished S1 heart sound when you're hearing an S3 sound. And the actual mechanism or the physiology of the S3 is during passive filling of the left ventricle. This is occurring during diastole. Usually this occurs due to the fact that the left ventricle is overcompliant. This will increase the load on that ventricle, and this is a major indicator of ventricular dysfunction. So we're just increasing that load to that ventricle. The ventricle is not compliant, so kind of creating that extra pressure, and that S3 sound can then occur. So we need to make sure if we do hear an S3 sound, there is a few populations in the world where this is actually non-pathological and is fairly common. Those populations would be children, athletes, and pregnant women. This is called a physiological S3. So I would recommend always, if you hear an S3, to make sure you check and rule out any other pathology, but knowing in these populations it could be normal. When would it be pathological? Anyone over the age of 40 and is a non-athlete or is not currently pregnant is usually a typical pathology for an S3 heart sound. So they are just going to have that increased volume overload on typically that left ventricle. You could suspect cardiomyopathy or heart failure could be occurring if you hear that S3 heart sound. And you could also hear it from a valvular regurgitation. It's less rare than a cardiomyopathy or a heart failure type incident. So make sure you do your other tests, and pitting edema could be occurring if that heart failure is occurring. So make sure you're checking that, also checking any respiratory symptoms with it. Thank you.